About opioids withdrawal. So what are the signs and symptoms of withdrawal of opioid drugs? It is generally the same for all opioids, but some of it might differ in terms of the onset, the time of onset, the length of the symptoms, and the intensity of the symptoms. It might vary according to the agent, according to the type of opioids. For example, short-acting opioids like heroin, the onset of withdrawal symptoms is around 8 to 24 hours. It will peak in 48 hours and the duration can be up to 10 hours. 10 days. But for long-acting opioids like methadone, which is used for the treatment of opioid withdrawal, the onset is a little bit delayed, 12 to 48 hours, but the duration can be up to 20 days. So what are the factors affecting these differences in terms of the withdrawal symptoms? The factors include age, average dose that they have been abusing, the general health of the individual, the length of use, and also the metabolism rate of the person. So these are the general presentation of opioid intoxication and withdrawals. You can read about this, and this is the duration of withdrawal of heroin. So we have divided the pictures here according to the duration of withdrawal. For example, in heroin use, within 24 to 48 hours, we can see that the users can experience any of these withdrawal symptoms. For example, body ache, diarrhea, loss of appetite, insomnia, panic attack, nausea, runny nose, watery eyes. So I think most of us can associate this like watery eyes, runny nose, sweating, right? Because these are the common symptoms that have been portrayed in the movies or the TV programs. In 3 to 5 days, they can have like shivers, abdominal cramping, vomiting, loss of appetite, and goosebumps. 6 to 7 days, they can have like anxiety, mild depression, trouble eating, and trouble sleeping. On the second week, their sleep is going to still impaired, but the mood can be stabilized. And the person can also have a post-acute withdrawal symptoms, which can happen 3 to 6 months after they stop the use. So they can still have these like psychological symptoms like anxiety, dysphoria, cravings, trouble in sleeping, depression, and irritability. What about the prolonged opioid withdrawal? So this PAW syndrome, the post-acute withdrawal syndromes, can last up to 9 months as well. And additional to the previous one, they can also get weight gain, increase in basal metabolic rate, decreased temperature, increased respiratory rate, increase in blood pressure, and also menstrual irregularities for a woman. We can see here that it takes time for the body to accustom once they stop the use of opioids. This is also the example of the timeline of the opiate withdrawal symptoms. You can have a look at that later. The goal of withdrawal management for opioid intoxication, we want to initiate drug abstinence and prevent the relapse. So we want to help the person to actually stop using it, and then we do not want them to seek for the drug again once they have been cleared from the drug. And we want to maintain patient comfort when, for example, if the patient needs hydration, we have to hydrate them. If the patient needs medication to help with the nausea and vomiting, so we have to provide them. So even though we want them to stop using it, but we cannot ignore all the withdrawal symptoms. We have to treat them so that the patient is at as much comfort as they can. Prevent and ameliorate withdrawal symptoms, prevent severe consequences due to that withdrawal. For example, for example, if there is an respiratory symptoms, if there are cardiac symptoms, we have to prevent any consequences. So we have to treat as much as we can, and also resolve general medical and psychiatric problems. So we do not want them to end up having depression or end up having anxiety at the end. Okay, and also social rehabilitation. So not only we want to fix them physically, but we also want to help them gain trust from the society. So for mild withdrawal, we at least we need to give them 2 to 3 liters of water for them to detoxify the drug and also hydrate themselves. Vitamin D and vitamin C supplements might help. For moderate to severe withdrawal, we can add some of the pharmacological agents, for example, methadone, clonidine, or buprenorphine. So mainly used in Malaysia is methadone for the treatment of opioid withdrawal. So these are the newspaper clipping for the methadone maintenance treatment. So the users, the ex-drug users, will come to get their dose at the pharmacy or at the center or at the clinic. They will have a certain amount of dose for them, so they will have to report themselves to the clinic, and then they will get their dose, and they need to finish the dose in front of the officers that are in charge. And then if there is a change in the dosage, so everything will be recorded. So Malaysia is the world leader in battling HIV spread with needles, says UK report. So this is following the government initiative of giving needle and syringe to the IV drug users. So it has been shown to actually succeed in terms of the reduction of HIV infection. Methadone maintenance therapy was introduced in 2005 as part of the harm reduction program. It started in Tampin Health Clinic. High level of compliance was found in the program, and the patient has to present himself at the clinic, and medication will be dispensed by the pharmacist. So he has to comply and adhere to the treatment regimen. So this is what we have discussed before. Methadone. So a little bit about methadone. It is an opioid agonist. So it will relieve the withdrawal symptoms and reduce the cravings of opioid because of the mechanism of agonist to the opioid receptor. But it will not cause the addiction, so that is why it is suitable to be used as the treatment. The ideal properties of opioid agonists, in terms of the chemical properties, it has high lipophilicity. It will accumulate in the body tissues and it will retain longer in the body, so that is why the half-life of methadone is longer as compared to the heroin or morphine. Because of this accumulation in the body tissues, it will cause a small fluctuation of plasma opioid level. So it will minimize the withdrawal symptoms to the patient. And it is available orally, so it will reduce infectious complication from injection. So there is no need to do any injection because it is available in syrup. Pharmacokinetic properties, it has long half-life and it only needs single daily dosing. So it is convenient to do the treatment program with only once daily dosing. The effects last longer than heroin, more than 24 hours, so abusers can stop taking the previous opioids and become drug-free. And it can cause a gradual rise of plasma opioid level. It peaks after about 6 hours. Pharmacodynamic properties of methadone, it can cause cross-tolerance with heroin. So the person is tolerant to heroin will also be tolerant to a drug equivalent amount of methadone, meaning that when a person is tolerant to a certain dose of heroin, the dosage of methadone needed to alleviate the withdrawal symptoms of that heroin is going to be almost similar. And there is also a cross suppression between heroin and methadone, meaning that methadone is going to reduce any withdrawal symptoms because it acts at the same receptor. So instead of using heroin, the person can use methadone to prevent them to have withdrawal symptoms. It's like replacing heroin with methadone and methadone is not going to cause any more addiction, it's not going to cause any more tolerance issue. So slowly the patient can taper down the dose and then be free from the opioids. And higher dose of methadone can block euphoric effects of heroin, so it will reduce the need or desire to seek for heroin. So it will block the sense of happiness, so the person cannot really get the benefit from heroin anymore, so it will reduce their desire or need to get heroin. And it can also cause normalization of neuroendocrine and immune system function, and it is free from toxic or dysphoric effects, and it is medically safe. So from these properties, pharmacokinetics, pharmacodynamics, and also chemical properties of methadone, it makes it a suitable and appropriate and the best treatment for opioid withdrawal and also opioid addiction. Regarding the dose, it depends on the differences in metabolism rate of the person, and also it may depends on the body weight and also opiate tolerance. And the dose must be reviewed on a daily basis and adjusted based upon how well the symptoms are controlled and the presence of side effects. So basically, if the person is taking a large dose of heroin before, so clearly they also need a large dose of methadone in the beginning of the treatment program, and then the dose of methadone will be reduced accordingly. Usually we start with 30 milligram and then 35 and then 30, and reduce gradually every day by 5 milligram until day 15. So other treatment may also include clonidine. It is an alpha-2 adrenergic agonist, provide relief of sweating, diarrhea, vomiting, abdominal cramps, chills, anxiety, insomnia, and tremor. But we need to measure patient's blood pressure and heart rate before administering clonidine. And it starts with 75 microgram, continue with 150 microgram TDS if BP does not drop or patient is not dizzy. Another example is buprenorphine. It is a partial opioid agonist, can also alleviate the withdrawal symptoms and reduce the cravings. Should be given after patients begin to experience withdrawal symptoms, and it must be reviewed every day. So these are the starting dose of buprenorphine. So if you want to know, have a look more on this topic, I use these references, but of course there are tons of references about this topic as well, including the opioid abuse and the use of methadone. So I think that's all for now. Thank you very much.